Hi, this is Ruth Werner, and you have clicked on the audiovisual sidebar to accompany my article, Tic Douloureux, the mysterious and frustrating condition of trigeminal neuralgia. In this short video, we're going to talk about the special kind of pain that TN represents. Then we're going to do a little overview of some other facial pain syndromes, because to treat these requires a solid diagnosis. Lastly, I'll talk a little bit about some of my own reactions to this situation and how it informs the way I write and speak about diseases. In the world of pain studies, there are about a bazillion ways to describe and categorize various types of pain. One of my favorite resources for this is the writer and educator Paul Ingram, whose material is often targeted at massage therapists and other manual therapists. Paul has given me permission to share this graphic with you from his website. In this diagram, we are delineating between two main types of pain, nociceptive pain and neuropathic pain, and then acknowledging that there are many situations that don't fully fit into either category. This is other. Nociceptive pain is typically related to damage of non-neurological tissues. A kitchen accident that leads to a cut is an example. The skin is damaged, and our nociceptors, our harm alarms, send that message upward, and our brain interprets that as pain, the unpleasant sensation that tells us something has been injured. Inflammation is often part of nociceptive pain, and that contributes by putting pressure on nociceptors and prolonging those messages. When we treat nociceptive pain with medication, we can typically use over-the-counter anti-inflammatories or analgesics that act on the peripheral nervous system, and they work pretty well. By contrast, neuropathic pain is related to damage of neurological tissues. It has some reasonably predictable patterns. It has a sharp, stabbing, burning, or electrical quality, and it does not respond to typical painkillers. In fact, the drugs used for neuropathic pain act by tamping down neurological activity. This can dull the pain, but it dulls the person too. Most patients report side effects ranging from annoying to intolerable levels of fatigue, fogginess, and general loginess. And this, of course, is something we see a lot in patients who have trigeminal neuralgia. TN has qualities of neuropathic pain, for sure. Something irritates the trigeminal nerve, and those bolts of pain affect whichever branch has been activated. But there are aspects of TN that are nociceptive as well, and that could have to do with chronicity and central sensitization. And this may be a factor in how difficult it may be to get a good handle on whether a person's facial pain is from trigeminal neuralgia or not. Obviously, it's really important to figure this out, because unpredictable drop-to-your-knees paroxysms of agony are not a sustainable lifestyle. And it is important to pursue the treatment option with the best chance of a successful outcome. So here's a list of other conditions that might be confused with trigeminal neuralgia. Persistent idiopathic facial pain, sometimes called atypical facial pain, is a condition that's similar to TN, and in some cases it might be a predecessor to it. It's characterized by pain that is less severe, but it tends to involve continuous rather than intermittent pain. This pain may go up over the back of the head and into the scalp, which means it may involve the occipital nerve as well as the trigeminal nerve. Occipital neuralgia is damage or irritation to that occipital nerve that can cause unilateral head and face pain, but the distribution is totally different. It affects the upper neck, the back of the head, and behind the ears. A couple of conditions are related to facial nerve problems. The facial nerve, cranial nerve number 7, is the main motor nerve for the face, and these conditions might include Bell's palsy and hemifacial spasm. Bell's palsy is the result of damage to the facial nerve. It causes facial drooping because the muscles are not getting proper messaging. Bell's palsy can also cause pain, mainly because all of that muscle slackness on one side, plus not being able to properly close the affected eye. But it doesn't usually take the form of that sudden jabbing pain that we see with trigeminal neuralgia. Hemifacial spasm creates a painless tic that's related to blood vessel compression of the facial nerve rather than the trigeminal nerve. And again, it's painless. That's a big giveaway that it's not TN. Glossopharyngeal neuralgia is similar to TN, but this one affects cranial nerve 9, the glossopharyngeal nerve, which supplies sensation to the tongue and the back of the throat. Postherpetic neuralgia is a complication of herpes zoster or shingles, and it may occur wherever those blisters appeared, which can happen on the face, but PHN can outlast the visible lesions by several weeks or months. When the herpes infection affects the optic nerve, PHN can create extremely painful facial symptoms, but it is not trigeminal neuralgia. TMJ disorder can cause extreme pain in the same areas as TN, but in this situation, the irritation begins at the temporomandibular joint, not the roots of the trigeminal nerve, and it requires a different treatment protocol. A cracked tooth or other dental problems can cause nervy pain if the pulp of the tooth is disturbed. It's important to rule this out before jumping to the conclusion that a person has TN. Other things may also mimic TN, but this is a good starting place for differential diagnoses. I have a special message to massage therapists who have clients who have been diagnosed with trigeminal neuralgia. I just want to tell you this would be a wonderful topic for a case report. And if you'd like to pursue that, I would like to help. Please feel free to contact me, and I'll do what I can to help you out. As a pathology writer and educator, I spend a lot of time reading and thinking about people who are sick. That's my job. When I'm communicating with others, I work hard not to overstate the negative impact of diseases. I don't use words like sufferer or affliction or victim, and that's a conscious choice because language like that is disempowering to the people who live with challenging conditions. But in the context of trigeminal neuralgia, it's really hard not to be pulled into that kind of thinking. This condition is a particularly difficult one. And once again, I want to express my gratitude to my friend and neighbor, Susan Fox, who shared her story, which is full of hope and resilience and self-efficacy. I hope you can look at the challenge of trigeminal neuralgia and of other hard-to-manage painful conditions with a similar sense of optimism. Massage therapy has a lot of good work to do here. Now, your job is to go out and do it. Thank you.